In a mental health rehabilitation center, a nurse named Marcus rubs his temples in frustration as his patient David completely shuts down during his morning routine. Across the room, Maya, a clinical administrator, pushes away her laptop, paralyzed by a mountain of new compliance paperwork. What we are looking at is a collapse of collective efficacy. This is the shared belief within a group that they can solve problems and improve lives through unified effort. When that belief breaks down, the entire environment feels it. The behavioral consequences are immediate. Staff members experience intense burnout and instinctively revert to a punitive custodial orientation. They stop trying to foster independence in their patients and instead rely on punitive measures just to maintain order and control. To understand why this happens, we have to look at the foundational theories of psychologist Albert Bandura. His research on self-efficacy shows that human behavior is heavily dictated by how people perceive their own capabilities. Marcus is experiencing a classic misattribution error. He looks at his failure to manage David's routine and decides he simply lacks natural authority. He attributes the breakdown to a permanent internal flaw within himself. When an organization hits this level of systemic fatigue, a leader cannot fix it by simply demanding that the staff work harder. Telling someone without the right tools or belief in their own capabilities to just push through is actively harmful. Instead, a leader must step in and physically and psychologically architect a new reality. Dr. Aris, the clinical director, begins by reframing Marcus's failure. She treats his struggle as an environmental problem rather than a personal deficit of authority. This matrix evaluates performance determinants. Notice the distinction between internal ability and external factors. Marcus's powerlessness stems from walking down a long hallway to a supply closet, a highly variable external factor, his physical task environment. Dr. Aris provides a physical solution. She grabs a heavy rolling supply cart and wheels it directly to the nurse's station, right next to the medication window. By decentralizing the supplies, she aligns the physical resources to meet the actual task demands. The environmental roadblock is gone. Marcus instantly gains back precious minutes of his shift, restoring the clarity of his task and eradicating his sense of powerlessness. Next, Dr. Aris turns to Maya, who is facing a sweeping new administrative protocol. The staff already feels overworked. They view this new system as an impossible burden, and overall compliance has dropped to 30%. Aris issues a counterintuitive directive. She tells Maya to ignore 90% of the new protocol. For the next 2 weeks, the team will focus entirely on mastering a single new intake assessment form, nothing else. This is proximal goal setting. Attempting a massive objective halts progress because the sheer volume triggers anxiety and task avoidance. But breaking a system down into a staircase of short-term proximal milestones allows incremental completion rates to compound. The team easily masters that single form. That quick, incremental win provides an inactive mastery experience. According to Bandura's research, these mastery experiences are the single most potent source of self-efficacy, providing the exact confidence Maya's team needs to tackle the next small module. Dr. Aris returns to Marcus and David. Marcus had been using negative social persuasion, telling David what he was doing wrong. This systematically undermined David's belief in his own ability, causing him to view independent live-in tasks as personal threats. This flowchart illustrates how self-efficacy is formed. The left-hand inputs, enactive mastery, vicarious experience, and verbal persuasion feed into capacity estimation, culminating in performance. To get there, Aris gives Marcus a blueprint, guided mastery. He breaks David's routine into subtasks and models the behavior. As David attempts the subtasks, Marcus replaces empty praise with highly specific, formative feedback framed entirely around self-improvement. He structures the opportunity for success, gradually withdrawing support as David learns. Marcus transitions from a frustrated custodian into an architect of his patient's success. The chaotic environment of the rehabilitation center stabilizes. Patients have clear routines, and the staff has the physical and psychological tools they need at the point of care. The team has adopted a new perspective on failure. Stumbling is no longer viewed as a pathology to be eradicated, but as a functional, necessary catalyst for human growth. Self-efficacy is not an isolated individual trait. It operates collectively within an interactive social system. When a group shares the belief that they can solve problems through unified effort, that confidence spreads. But when they feel powerless, the entire milieu absorbs that defeat. When leaders stop demanding blind compliance and instead actively architect opportunities for success, aligning environments and structuring feedback, they resolve the immediate crisis and vitalize the entire environment.